Hello. This video is about what I do after a knee dislocation and I hope it helps you. Your experience may be different depending on your body, why you dislocated, and if there are any other complications. A full dislocation can be very traumatic to the body and take weeks or even months to fully recover from. I took it much better when I was younger and recovered faster. Sometimes my leg shakes uncontrollably for a while after. My leg muscles go into a sort of shock and don't respond, but after a few hours my quad will begin firing again. The nature of my dislocations means I am prone to have it happen again, or to have the other dislocate too. So I need to take it easy and I need to do some exercises to help it stay in place. First, I try to rest. To reduce swelling, I relax and put my leg on pillows, above the height of my heart. Applies 20 minutes on, 20 minutes off. A toddler's boo-boo pack is probably not going to cut it. I always have multiple cold packs in my freezer, because that's my life. You may have to go for the bag of frozen veggies. Now I have special knee braces, but in the beginning I used to wrap ace bandages around my knee. Sometimes I use athletic tape. Sometimes I can limp around but often need to keep the leg straight for a while or use crutches. I try to listen to what my body is telling me. If it hurts a lot to put weight on it, I try not to. I do try to get it moving as soon as I feel up to it, since if you don't move a joint for weeks or months it does get stiff and hard to move. When I calm down I sometimes make a doctor appointment. There are a lot of reasons and benefits to do this or go to the hospital or urgent care. There are a lot of possible complications from dislocating and your doctor can examine your leg and order images to check for damage that can only be seen with an X-ray or MRI. Depending on your health insurance, you may need a referral from your primary care office to go to physical therapy or a specialist. Some plans may cover a brace or devices to assist you. You may need proof for work and children may need a doctor's note to excuse them from physical education. An orthopedic specialist will examine you and any images you get, and look at your history, see if physical therapy can help you, and determine if you require, or are a candidate for surgery. If you need crutches, a brace, or another device, there are several things to try. Many stores do carry them, but I would call around or check online to check stock or prices. Senior communities sometimes have a place to rent crutches or other mobility aids free or at a low cost. In the UK I heard you can borrow them from the National Health Service. You can post on social media and ask your friends or family, or in local groups. You can ask them to check thrift stores for you, but that is definitely hit or miss. You can search for groups in your city, including the Buy Nothing Project on Facebook if it's near you. Make sure you find your nearest one and answer the questions to join. After several dislocations, on both knees, I went to an orthopedic specialist and they called it patellar tracking disorder and said this is somewhat common. They recommended surgeries to reduce the muscle, which did not help. I don't think that is a common practice anymore. There are newer procedures that benefit people more. I recommend following doctor's orders and getting treatments if offered. I did not know that hyperextending joints, and all of those dislocations were traumatic and would hurt me later. I now suffer from pain, anxiety, and osteoarthritis. Please remember to subscribe to this channel, and if there's anything I forgot that has helped you, please comment and let us know. If your kneecap is like mine and likes going on occasional little adventures without your permission, you are not alone. Join our Facebook page and group for discussion and support. You can also check out the links in the video details. I'm partnering with a site that offers crutches and other items we sometimes need. Take care and I'll see you next time.